years, there is a lot of pruning, you know, sort of trimming the hedges kind of, that your brain does, and that's normal. And maybe that process is going awry somehow. Maybe Edward Scissorhands is getting kind of crazy and he's kind of cutting down to the quick, you know, and the nerve cells are getting kind of hacked back when they shouldn't be. Because that might explain too why it's kicking in at that age, you know, at that young age. In essence, though, I mean, we don't know what, we have those theories, but we don't know why that would happen. You know, is it some genetic thing? Is it some exposure to a virus that then causes the immune system to overreact and kind of kill off the nerve cells or do something funny there? We don't know that. Another type of psychotic disorder. Have you heard of schizoaffective disorder, anyone? That's a different one, kind of. I think of that as kind of a cross between schizophrenia and bipolar disorder, or depression. So if a person has schizophrenia-like symptoms, so there are times when their mood is normal, but they get psychotic, and they have these delusions or hallucinations, but their mood is normal. That could be schizophrenia, right? Well, now let's say they have a lot of mood problems, though. They have a lot of depressions that are mixed in with their schizophrenia. If they just have like one episode of depression and then over 5 years and the rest of the time it just looks like schizophrenia, that's probably not schizoaffective disorder. If they have 2 or 3 or 4 episodes of some kind of mood problem, whether that be mania or depression or both, then it's like a cross between a mood disorder and schizophrenia, and we call that schizoaffective disorder. The only reason that makes a lot of difference is because of the way we treat it. So folks like that, let's say it's bipolar type symptoms, it's mania and depression, and then a lot of the psychosis. Those folks would probably be treated a little bit differently, maybe with a mood stabilizing medicine in addition to an antipsychotic medicine. Okay, so that's the main difference. And I just wanted to cover it just because, you know, you may hear that at some point, and that way at least I've done it justice. One that's really, really interesting that I want to spend a little more time on is called delusional disorder. The reason this is so interesting is because it makes a psychiatrist's life very difficult with this disorder. Folks will come into your office and they'll tell you this big, elaborate story about something that's going on, and you're right with them. You're following there, and you're like, okay, I can see where that would happen. I can see where that would happen. I can see where that would happen. And then the spouse comes in, you know, next session or whatever. You know, none of this has ever happened. And, you know, yeah, he had some trouble with it. And I'll give you some examples. But it's basically a non-bizarre delusion. It's something that's believable, but it isn't true. It isn't happening. And the only way you know that is to get history from someone else. And usually you need more than one person, because what if the spouse is really just wanting to get this person out of their life, and so they're making all this up? You can't just trust one other person. You really need to kind of get some history from the other folks in the environment, boss or, you know, spouse or some other folks. But these delusions are, again, they're thoughts. They're commonly like paranoia or something like that. And this person really thinks this stuff is happening. It's their reality, okay? But it just isn't happening. The behavior's not odd, like in schizophrenia. It's not the same thing. You know, these folks, like I said, their behavior's kind of different. Their speech is sometimes different. And these folks, I mean, they're just, it's like you or me walking around out there. It's just that when you talk to them, all they talk about, they are just focused and fixed, and it's so pervasive, this thought, or whatever it is, this idea, this scheme, or whatever's going on around them. They don't usually have hallucinations. It's not common for them to hear things or see things that go along with these things. Now, what are these types, okay? Have you heard of erotomanic? That's kind of a fancy word, but erotomanic delusional disorder. You guys remember when Letterman was getting stalked? Remember that, David Letterman, you know? Remember that woman that was constantly going out? I think, it's somewhere I read, I think, that she probably had erotomanic disorder. This is where a person thinks that somebody, usually somebody of higher stature, whatever that means, is in love with them, or that they're meant to be together. It's the destiny and everything to be together. And these folks will go to no end. I mean, they'll stop at nothing to be with this person. Even though this person looks them right in the eye or gets a restraining order or whatever, you know, they don't get the idea. They don't get the message that, look, you know, like Letterman did, you know, I don't want you coming across into my property. That's erotomanic disorder. I've seen that a couple times in my practice, and it's tough because you cannot, no matter how much you rationalize and reason with this, look at this is a restraining order. You know, they're taking you to court. Now we're in court because of this. You must not call them anymore. But I'm sure we're supposed to be together. I'm going to call them tonight. You You know, I mean, they do. They break the restraining order, they end up in jail sometimes. It's a very difficult thing. Grandiose, the grandiose type of delusional disorder is sort of like we talked about it. It's not so bad as, it's not odd like, you know, thinking you're Jesus Christ, but somehow feeling that you have a special relationship with God, or that you're a famous person, or, you know, that there's something very, very special about you. A jealous type. This is where, and I've had several cases of this too, this is fairly common. I think the most common ones are erotomanic, paranoid, and jealous type. Jealous type is, my spouse or significant other is having an affair. I absolutely know it. And I've seen this evidence, and that evidence, and this evidence, and that evidence, and I swear I saw her driving down, you know, this is a 60-some-year-old man. I swear I saw her riding in the back of a Harley with this guy down through town. And I saw stains in her underwear, and I saw this, and I saw that, and I saw, you know, all these things, you know, and completely obsessed with it. Could not get it off of his mind, you know, and it can happen with women too. But you really, and then once you treat it, it's still, again, like I said, you use the medicine. They're not talking about it all the time anymore when they come to see you. But if you ask, yeah, I know, that still ticks me off that she had that affair with that guy. But I don't think she's having it now because I don't see any evidence anymore that it's occurring. You know, so they still hold on to the thought that it's happening. And let me tell you, that's tough on a spouse, as you can imagine. I mean, they think, boy, you know, this person is, you know, I mean, I can't breathe, because they smother them. Persecutory type. I'll give you another example. This is one, a couple examples of this one. This is one where the person is convinced that somebody's out to hurt them in some way, or their family in some way. Okay? One case I saw when I was a resident, I was at Lewis Carter Hospital doing a rotation. This was early on. I'll never forget this case. It was kind of an interesting, a middle-aged lady who had a 19-year-old daughter, and her daughter had attended a party where there were parents. The young girl whose parents, I mean, where this one girl had a party, okay, and invited this girl, this patient's daughter. Well, unfortunately, at this party, this girl fell down the concrete steps, had a massive head injury, and died. Okay. And of course, that's a major shock to lose your child, right? But this woman, I think she got depressed at first, and then she just started, this delusion started to develop, and near as we can tell, it was a delusion from all the police and everybody else that were involved, that the parents, or that this family had set this up to kill this girl, and had set it up so they could push her down the stairs and kill her. She was so distraught about this, and this went on, I guess, for like a year or something. She wasn't getting much treatment because it hadn't, you know, the family, I guess, was worried about it, but they didn't bring her into any treatment. Well, she happened to see these folks, some members of this family that she was so focused on, having hurt her daughter, see them coming out of a restaurant in a rearview mirror after she had just come out, put her car in reverse and slammed on the accelerator and ran over some person of this family. Okay. Obviously, she went to jail for that and then went before a judge, and the judge said, "You're not competent to stand trial. You can't understand what's going on here," you know, because she was obviously fairly delusional. So they sent her to Lewis Carter for us to try to treat her so that she could understand, you know, how to help in her own defense and things like that. We couldn't shake it. We could not shake that delusion, no matter what kind of treatment. And part of it is too, she didn't want any treatment. She didn't think there was anything wrong with her. At first she was depressed, and then we were able to treat the depression, but she still was very delusional about this, and we couldn't, there was nothing we could do. And of course I don't know what happened because I rotated off, you know, and went to a different rotation at that point. But interesting case. One other case was a gentleman who, I mean, this kind of stuff could happen to any of us, right? He's working and he sees his coworker do something that was really unethical or shouldn't have been doing. I don't know what it was. And he sort of spoke to the supervisor about it, you know, maybe narked him out, I don't know. But, you know, he spoke to the supervisor about it. The guy got in some trouble, and he found out that this guy had turned him in. This guy, he threatened this, you know, the guy that got in trouble sort of threatened the patient and said, you know, I'm going to get, or you'll get yours, or something like that. I mean, he didn't do anything, he didn't wave any guns in his face, he didn't beat him up or any of that, but just a verbal threat in some way. And then that was really about it, as far as we can tell. But this gentleman